So to start us off, I would like to acknowledge the land that we are living and working on. Veterinarians Without Borders, staff, volunteers, donors, and supporters live and work on the traditional territories of First Nations, Inuit, and Métis peoples within Canada, from coast to coast to coast. Our head office is situated on the unceded and unsurrendered territories of the Anishinaabe Algonquin Nation, whose presence reaches back to time immemorial. I wanted to also acknowledge that tomorrow is the National Day for Truth and Reconciliation. So let us remember the calls to action embedded in Truth and Reconciliation Day as we strive to build a society where the principles of justice, equity, and reconciliation guide our actions. I'm excited to be joined today by three former volunteers, Marley, Keisha, and Sandra. The three of them all volunteered in Ghana this summer. Through our Young Volunteer Program. So the Young Volunteer Program is part of our VETS project. VETS stands for Volunteers Engaged in Gender Responsive Technical Solutions. VETS is a 7-year project which is generously funded by Global Affairs Canada. The goal of the VETS project is to work to improve the economic and social well-being of the world's most marginalized people, particularly women and girls in 6 countries in Africa and Asia. I'm going to shortly pass the mic over to Keisha, Marley, and Sandra, who are going to talk about their experience in Ghana this summer. And then after we hear from them, I'll pop back on to talk about some logistics for the Young Volunteer Program, like our eligibility requirements and the application process. And then at the end, we'll be happy to take any questions. So just a reminder, any questions that come up, you can put them in the chat and we'll respond to all questions at the end. So I'll pass it over to you, Marley.
Okay, great. Thank you, Megan. I'm just going to go ahead and share my screen here. Okay, great. Megan, can you see my screen okay?
Yeah, looks great.
Okay, perfect. All right. So I'm just going to go ahead and before we get into kind of what our daily life in Ghana looks like, I'm just going to go ahead and introduce our local partner. So within the VETS project, whenever you go into a country, you get paired with a local organization. So we were lucky enough to get paired with the Ghana Poultry Network, GAPNET for short. Which is a community-based nonprofit, non-governmental organization based in Ghana, whose aim is to support livestock management and improve farming practices to increase household income and improve food security. One of GAPNET's main focuses was promoting sustainable, One Health-centered projects, and a lot of those in accordance with the Vets Without Borders VETS project. So a little bit about where we were located in Ghana. So looking at Ghana here, we started off our 3-month journey in the city of Accra, which is the main city in Ghana, way down south. And then we moved all the way up east and lived there for 2 months in a small town called Ewa, which is just outside of the city Bolgatanga. So the map to the right here kind of has the stars where Ewa is, right up against the Burkina Faso border. All right. So I'm just going to talk about a little bit about one of the first projects that we were tasked with when in Ghana. So after completing our in-person orientation in Accra and flying up to Ewa, we started with a 5-week Peste de Petite Ruminants, or PPR, vaccination campaign. So just a little bit of a background of what PPR means. So PPR is a highly contagious viral disease of sheep and goats, and it causes a very high morbidity and mortality. And this is a big problem in Ghana right now due to a free-range system. So what that kind of looks like is during the morning, animals are let out of their houses and they have the day to roam and go wherever they want and interact with whatever animals they want. So we ended up seeing a high level of disease transmission, especially of PPR, which is really not good when you have a lot of people relying on animals as a source of livelihood and quote unquote quick cash. So what the aim of this campaign was to eradicate PPR by 2030, and this was spearheaded by the Economic Commission of Western African States, known as ECOWAS. So this isn't something that was happening mainly in EUA, it was happening across Western Africa, and we were kind of acting as extra hands to help vaccinate. So we were lucky enough to spend 5 weeks working along the community animal health workers who were trained by the VETS program to vaccinate sheep and goats against PPR. So what we did is we traveled over these 5 weeks to 13 different communities across the Upper East. And typically what that looked like is we'd wake up, arrive at our vaccine site around 7 or 8 a.m. in the morning. And thanks to the community animal health workers, they would have told the community we were coming, and farmers brought all of their sheep and goats and had them tied up and ready and waiting for when we got there. The first couple of weeks, we were also tattooing. So we would kind of split roles between vaccinating and then tattooing the animals that had gotten the vaccine. And we would do this until about noon when it started to get pretty hot. And then to beat the heat, we would typically head back home and kind of have the afternoon to work on some other tasks or have a little bit of free time, which was really nice. So here we've just got a couple of pictures of kind of what the day in the life looked like of doing the vaccines. All right, and some lessons from the field. So a little bit of a background on myself. I just graduated from the University of British Columbia, so I'm actually not currently in veterinary school. So kind of going into this experience was a little bit intimidating. My two other wonderful colleague volunteers, they're both in vet school, and they were a huge resource for me in terms of learning different medical kind of terminology and techniques. And so, yeah, going into the first day of the vaccines, I was very nervous. We arrived and there was, I think, 400 sheep and goat tied up waiting for vaccines, and I had never vaccinated a sheep or a goat before. So we were really lucky that we had our supervisor, who is a doctor actually from Canada, who came over with us for the first couple of weeks. She taught me at least a lot about the proper way to restrain for the vaccines, how to safely give the injection, and a little bit more about kind of what the veterinary system was like in Ghana. So as well, we were able to assist with some additional medical care aside from vaccines. We were told only to vaccinate the healthy animals, but of course, every so often you would see some animals that weren't healthy. So we were able to participate in some additional learning, I would say. So I've just included a couple of pictures here. So on the left, here's a goat that has a cyst that's currently being removed by one of the veterinary paravets that we worked with. So every vaccine site had a paraveterinarian there who was kind of supervising the event. So if we had any questions or concerns, we could go to them. So that is what's happening in that photo. The middle photo here, this was a goat that it's somehow in the process of vaccines, whether it had gotten in a fight with another goat, had broken its horn and was experiencing a lot of bleeding. So we got to practice our wound management skills and stop the bleeding, and we're able to send the goat happy and on its way. And then the third photo here I included because even though we weren't doing vaccines on cows, one day we had a farmer come and tell us that his cow hadn't been eating and was unwell. So we were very lucky. One of the volunteers, Keisha, is a graduate from OVC recently. So she did a physical exam on the cow, and this is a photo of her deworming it. So yeah, I definitely was able to learn a lot of technical skills that I will be taking forward with me in my future career, hopefully as a veterinarian. And a lot of that is in thanks to my volunteers, Keisha and Sandra, as well as Dr. Alina, who was our supervisor, and then of course the veterinarians and paraveterinarians in Ghana that we were able to learn from as well. Okay. And some additional lessons from the field that are a little bit more on the soft skills, not the medical skills, was a lot about cross-cultural communication. So we were faced with some instances communicating with older people from Ghana who maybe didn't have the best understanding of English. So it provided me with an opportunity to learn a little bit more about other ways than language to communicate whether something had been vaccinated or was having a problem, whether that be through hand motions or something else. And as well, it gave us the opportunity to speak a lot with the local veterinary staff. So some days we would arrive and there might not have been a lot of animals, but we were able to speak with the veterinary technician and kind of find out a little bit more about the medical system in Ghana, what diseases they're seeing commonly, how they would treat it, and then maybe offering some advice on how that differs from Canada and how we would approach a situation, which I think is very important because you never know if you're doing something the appropriate way. So definitely cross-cultural knowledge translation was something that I hadn't come across necessarily before this experience. And it gave me a very good opportunity to practice that. And now I do feel more comfortable going into those situations. And then one of the last big skills, I think, specifically from the vaccine campaign that I learned was adaptive thinking. So with a vaccine campaign, it can sometimes be, a fast-paced environment. We only have a couple of hours and sometimes lots of sheep and goat to vaccinate and sometimes a little bit less. So we would arise with small problems of, running out of vaccine that day, or an animal coming with a health problem that was maybe contagious to the other animals, or maybe we didn't have a lot of people show up that day. So it was kind of an opportunity to practice being adaptable and flexible to your situation, and learning how to be okay with changing in a fast-paced environment, and how to appropriately change those circumstances. So I would say that is definitely one of the big things that I learned from the vaccine campaign. And here to the right of the photo, we have a couple of pictures of some community members that had actually rented these tricycles to bring their sheep and goats to our campaign. So that was really cool to see. So yeah, I learned a lot, and I'm going to now pass it off to Sandra, who's going to talk a little bit more about our next task.
Okay, thank you, Marley. Hi, everyone. My name's Sandra, and I'm going to be talking about the second main task that we undertook in Ghana, which was our training sessions for women's groups. So our main topic for our training sessions was, we called it the 10 Commandments of Raising Animals. And we were focusing specifically on goats, sheep, and then all types of fowl, because those are very common animals that people in rural Ghana are raising. So in terms of fowl, we were talking about guinea fowl, which is an animal that I hadn't even heard of before going to Ghana, but you can see it in the picture on the bottom right there. It's kind of like a primitive kind of chicken that people eat, and then they also make eggs that people eat as well. And then also chickens, ducks, any other kind of fowl. And in our sessions, we talked about a lot of different topics. So some of them included talking about proper diet, providing feed, and then good, clean water to your animals. We talked about shelter, whether like some people who attended our sessions didn't have currently any shelter for their animals. So we would talk about maybe means of building that shelter, or if they did already have a shelter, ways in which it could be improved to maybe be more weather resistant, or just a bigger space for the number of animals you have. We talked about hygiene, like cleaning your shelter, making sure your animals are in a clean environment. We talked about biosecurity. So that was often concepts that would help to keep your animals from getting sick, whether that means, separating a sick animal from the rest of your healthy animals and how to do that, or proper ways of interacting with your sick animals so that you don't pass on disease to your other animals or to yourself and your family members. We also talked about the importance of vaccination, how to raise chickens and guinea geese, which are baby guinea fowl, and then also how to get rid of animal carcasses from a sick animal and prevent the spread of disease from that animal carcass. So we had quite a few different topics we talked about, and I just put some pictures, just some cute pictures I had from being in Ghana. There's some baby goats there that were living next door to us. That's Marley doing a physical exam on an animal in the field. Okay, so we're going to do next slide, Marley. Thank you. Okay, so how did all this work? So we had our topic, but how did all of this run for us in the field? So we had started our experience in Ghana with doing the vaccination campaign that Marley had talked about. So in our kind of downtime that we had, so when we had those afternoons off, we spent some time deciding on the topic for our training. And we did that in collaboration with GAPNET and then also with another Vets Without Borders volunteer, Dr. Joseph Ansong Dakwan, who is a volunteer for VWB, and he's done trainings in the past. So we picked a topic. We also did our own research using various resources to come up with our presentation, and then we made an outline for our presentation. So we worked on all that prior to the training. And then once the training started, we spent most of the first week, we went in and we would go to different communities in the Upper East region, and we were shadowing Dr. Joseph on his training, getting a sense of how he worked with the crowd and what kind of information he shared. And then when we moved on to the next week, and then also beyond in our volunteer experience, we did a few extra training sessions. We were spearheading the training on our own. So we would travel to different communities, and then we would run our own training sessions. So usually that would mean just meeting a group of people outside. It would be under a tree, under a baobab tree, which are those huge trees that are all over the place in Ghana. Or we would just have like our folding chairs set up in a little pavilion. And the community animal health workers, who Marley mentioned, also helped us organize our vaccine campaign. They also helped a lot with the training, so they would help gather people together to participate. And we focused our training specifically on women's groups. So that's one of the major components of the VETS project by VWB, is to make strides to empower women in these communities. So what's really unique and kind of cool in Ghana and in the Upper East is that every community will typically have a women's group. That is just a group of women who have come together to sort of organize activities for women in the community. And oftentimes women are the caregivers of animals in the Upper East region in rural Ghana. So it was very important for us to sort of target these sessions towards women and make sure we had a lot of women come to participate and feel empowered and feel like they could gain some knowledge that would help them in their animal rearing. So yeah, that was our main goal there. And then I just put a picture up. This is one of my favorite pictures from the trip. So in the back, you can see this is all a bunch of members of the UA women's group. So they specifically went to one of our training sessions. And this was a picture actually at our going away party. So we had a little party in UA on the last weekend when we were going to be there. And it was really awesome. And we had a lot of people attend who we had met throughout our experience. And all the members of the UA women's group who had come to our training came, and they did a presentation for us. They danced and they gifted us with some items. So it was really obvious to see that they felt appreciative that we had been there. And it was just a really great kind of ending for the whole experience. So that's that picture there. And then if you want to go to the next slide, Marley. Thank you. Perfect. Yeah. So this is just some more pictures of scenes from our training sessions. You can see On the top left, this was our training that we did in UA that we actually did on the front porch of the house we were staying in. We set up chairs. So it was really just, wherever you could set up and have people and have some shade and shelter from the sun. That's where we would do it. In the bottom left, you can see us set up under a tree in a different community. And then on the right, that's just a picture of Marley and Keisha with one of the resources we had provided. It was like just a summary of all the different topics we were talking about. And you can see we put some pictures on there because we were trying to, of course, make it easy for everybody to understand, because as Marley mentioned, there are a lot of people there who don't speak English. So we had the help of a translator, and then we also tried to use picture representations of ideas when we could. Next slide, please. Okay. So here, just like Marley, I put together some lessons from the field, some things that I learned throughout training that I thought were really, really cool. And I was really happy that I was able to work on these skills in the field. So number one, obviously, is communication skills, just working on your skills for presenting in front of an audience, creating a presentation that is clear, concise, engaging, just working on crowd control. Oftentimes we would have quite a big crowd at our presentation, so it would range, but I remember one time we had almost 100 people come to our training because we were doing it outside in a public area, so people would walk by and hear that we were presenting and they would join in. So we had quite a few people there, so just learning to manage the crowd and make sure everybody's paying attention but also feeling engaged, feeling like they're participating. So that was really great. And then I also put on there communicating with the help of a translator. So for me, that was something I had never done before. And I thought that was a really cool experience. And it does kind of change the way that you communicate, because you have to sort of make sure you're being very clear, being concise, so that what you're sharing can be easily shared by the translator and then easily understood by everyone in the audience. So I thought that was a really unique skill to get to work on. Also, encouraging participation and collaboration from your crowd. So one of the things we were really sort of focused on was making sure that people in our audience for our training knew, like, you are the experts on this, like, you are raising these animals, you are farmers, you live here in this environment, you are the experts and we are not the experts. So, we have this information that we're sharing, but we wanted to make sure that we always had a collaborative environment where people felt like they could share their own stories and also ask questions and like challenge our ideas whenever it was appropriate. So one thing that I thought was really cool was that during our training, it was also for the UA women's group, we were able to do 2 training sessions with them. So in our first session, we were going over all the concepts that I discussed earlier. But then in the second session, we sort of made it a very collaborative approach where we did a bit of review of what we had talked about, but also we wanted to ask people, have you implemented any of the ideas we discussed? Are there any challenges you're facing? Or are there any big successes that you've experienced that you want to share with the rest of the women in your community to motivate them? So that was a really cool session where it wasn't really just us talking, it was sharing and it was community learning. So that was really, really great. Also, I put time management on here. So obviously you're doing a presentation that you want to fit into a certain time frame. You don't want it to be too long where you're losing the engagement of the crowd. So that was also something we had to learn. And it was really important too when we had a lot of attendees to our training, because we would often have a lot of questions, which is really great. The questions would be wide ranging, but then we would sort of have to figure out, we maybe need to cut this part of our presentation because it's not necessarily important to this crowd. We should talk about this instead because this is what they have questions about. So that was a good skill to develop. Flexibility and resilience. So, just like Marley said, with the vaccine campaigns, we never really knew what was going to happen on our training days, how many people we would have, what the issues that the crowd was facing were, and maybe that would change what we would talk about that day. So just going in, being really flexible and able to sort of adapt on the fly to your crowd to make sure that it's important and relevant for them. And I remember, like, unexpected things would happen because we're not in a conference room with like a microphone and chairs for everyone. Like you're outside. I remember one time we had a snake fall out of a tree during one of our training sessions, and it created like a big kerfuffle in the audience, and sort of getting people back from that and getting back into the training again. So you never know what's going to happen. And that was a really fun part of the experience. And I think it's something I'm going to take forward with me as a vet, a future vet. And then obviously research skills. So I'm a second year vet student now, but in the summer I had just finished my first year. I did not come from a large animal background or a farm background. So there was a lot of things we were discussing during training that they weren't my area of expertise, but we were able to do research not only, online with resources and books online, but also in talking to people in the community, talking to vets and paravets and community animal health workers we met to do research for what would be important for our presentation. So yeah, it was really, really great that I was able to work on all of these skills, and it was such a valuable experience for me, especially just coming out of first year. There's still a lot that I want to learn. So yeah, it was great. And I can't remember, Marley, do I have another slide after, or I might be passing it off to Keisha? Okay. Yeah, so that was all for me. So I'm going to pass it off to Keisha to talk about our third major project.
Thanks, Sandra. Okay, so our third project, which was kind of an ongoing background project, was a research questionnaire that was titled Assessing Animal Disease. Oh, also, sorry, hi, I'm Keisha. Assessing Animal Disease Surveillance Systems in the Upper East region of Ghana using a One Health approach. And so the surveys and research we were conducting was entirely anonymous. That was in order to encourage participants to feel like they could be open and honest without any fear of repercussion, especially because some of the cohorts, like veterinarians or cows, are such small groups of people in such a small region that maybe if we did username, it could be easily tied back. So I don't have any pictures of our survey per se, but as I go through this, it's just filled with some of my favorite pictures from my time in Ghana. So if you don't like what I'm saying, there's lots of pictures to keep you distracted. Perfect. And so, oh, Marley, can you go to the next slide? Thank you. So for our study objectives, what we really want to know with this research is that we wanted to evaluate the impact of community animal health workers on disease surveillance systems in the Upper East region of Ghana. And so a community animal health worker is a program, or they call it the COW, an abbreviation, a COW program that started in 2021. And so community members or volunteers were picked from 13 different communities in the Upper East region by GAPNET. And then they worked in collaboration with the VSD for licensing and whatnot. But they were then trained on non-invasive animal health procedures. So they can be called to farms within their local community to give dewormer, internal and external parasite prevention, wound treatment, just general knowledge of husbandry and animal care. And they're also trained on using a app that pretty much you can take a picture of a disease that you think might be reportable or of high importance, and then that can then be brought down to the veterinarians in the area, and then down to the major city in Accra. And essentially, if it's a reportable or a disease of serious issue, that then they can become aware of it in these very remote areas. And so that is what a community animal health worker is. Marley, can you go to the next one for me, please? Thank you. So how did we collect this data? We did in-person questionnaires, and then we combined that with individual or group interviews. So depending on the number of people, like there's only around 6 DVM holders in the Upper East region, so it wouldn't really be possible to do group interviews there, but for some of our larger cohorts, we could. And then participants included community members, farmers, district veterinarians, which for most often were DVM holders, and then paraveterinarians. And what we would refer to them here as like registered veterinary technicians, or RVTs. And then community animal health workers, all of which were involved in animal health management and disease surveillance systems. And so this research included people from, or individuals from 13 different communities in the Upper East region of Ghana. And to the left, you can see Marley with her adopted child, Bonku, getting his first vaccines. Can you go to the next one, Marley? Thank you. And so with this data, we really wanted to identify any successes, gaps, or limitations in the COW program. It is relatively new. It's a baby program from 2021. And so we wanted to see what was what was working, what wasn't working, and then how to improve the program overall for not only the cows, but the collaborators that work with them. And then that's just a picture of a beautiful, beautiful farm that we saw while we were in the Upper East. Thank you, Marley. So essentially what we learned or took away, I did personally, from this experience, especially in terms of research, but some of these takeaways are from my whole time in Ghana as a whole, was cross-cultural communication, research ethics and sensitivity, which is something that was quite new to me, language proficiency and literacy, logistical challenges, networking collaboration, which is personally my favorite, and then adaptability. And to the left, this is traditional mud style housing for some of the small ruminants in the Upper East region. So yeah, that's traditional mud style home. Can you go to the next one, Marley? Thank you. So for cross-cultural communication, I think like my colleagues like Marley and Sandra have spoken on it already, but working in a foreign country, it really provides you the opportunity to learn how to effectively communicate with people from different backgrounds, different ways of understanding things or interpreting or digesting data. And so I felt like myself and probably all of us gained insights into the importance of like cultural sensitivity and adaptability, and in particular in designing this survey and administering it. So I think a couple things like greetings before business. So sometimes here you might just be like, hey, like let's just get to what we're talking about. But I found in Ghana that it was kind of like, you got to say hi, and then you got to ask, how are you? Then you got to give your response, get a response, and things like that are just small things that make a big difference in how someone will engage with you while you're talking to them. Communication, I find, can be very literal as well. So I had to learn to not be so wishy-washy in what I'm talking about. And if I mean yes, I mean yes. If I mean no, I mean no. And if I mean later, I mean later, and set a time. And so all those things are very important to remember and can really, I think, if you're not following them, affect the trust or your engagement with the person you're trying to talk to. And then one thing we also noticed while administering these surveys is, at least for our cohort that we were engaging with, that participants often didn't like to ask for help or clarification. And so we also had to adapt in that way by making sure when we're administering these surveys or giving our brief introduction, just stating that it wasn't a test, that there were no right or wrong answers, that it was completely anonymous, that if you didn't feel comfortable talking to us, we have a translator walking around, so please utilize them. And so we had to kind of change the emphasis in our introductory statements when we were administering these questionnaires. Can you go to the next one for me? Perfect. And then next, research ethics and sensitivity. So ethical considerations are always important, but they can vary across countries. So we really had to learn to adapt some of our methods and questions to make sure we were respecting local norms, values, and standards. So when we're creating our questionnaire, we really had to be considerate of language and wording of questions as they relate to maybe gender, sex, household finances, or what the title of a head of a household is. And so I think that's something I never would have thought of having to think about. And so I'm really taking that back with me for any other groups I interact with in the future and engage with. Next one, please. Oh, wait, no, sorry, go back. This is my favorite photo, and then these are my godchildren. This is Bonku and Moose Stew. Sorry, I just wanted to introduce them. Okay, next. Okay, and then language proficiency and literacy. So Marley and Sandra kind of touched on this already, but although English is the official language of Ghana, there are many, I don't know actually the number, but tons and tons and tons of local languages that can be attributed to each tribe or group in different regions. So there's that, but then also not everyone in these rural or remote areas has the ability to be literate in English, and that has many factors that are involved in it. So that was something to consider. So unfortunately, due to time constraints, we had to exclude individuals, so a pretty large portion of individuals who could not read or write in English, which probably biased our data quite a bit. So we did have an interpreter there, but not with enough time to individually go with each person. But if maybe you had a lower grade level or understanding of English, that interpreter could be there to help with maybe spelling or understanding the question that was being asked. And then because our survey participants were from remote villages in remote areas, which in Ghana historically did not have free education for all levels of schooling, our data was also kind of age biased. So a lot of older participants were less likely to be fluent or literate in English. So the people that did participate tended to be younger as well because they've had that access to education and are much more proficient in English. So those are things to consider about data biases and kind of in conducting a survey in the future, even though the country as a whole as an English-speaking country, looking at different factors in different regions that may affect our data. And this is a place we visited a lot. This was the veterinary store in the nearest large town to Ewa, so BCO Vet Agro Inputs. Okay, next one. Thanks, Marley. Okay, and then for logistical challenges, I think the biggest one was coordinating survey administration, which I definitely think can be taken back to Canada as well, the skills I've gained here. So asking a farmer or a community member or whatever in Upper East region of Ghana to fill out this survey or take an hour out of their time to come bike to come see us or wait for us to come see them in the middle of a very important growing season that only happens once a year to grow food that they use for sustenance is a difficult ask. And it's the same thing, not the exact same thing, but something that can be similar here. So I like to relate it to trying to ask a farmer to fill out a survey here in Ontario in June. It's just not a good time. It's a terrible time. Everyone's very busy. The fields require a lot of work, a lot of maintenance, especially where we were. It's very labor intensive growing practices where seeds are manually sown, weeds are manually removed, and food is manually harvested. So just trying to kind of work around people's very, very busy and understandably busy schedules. And then veterinary staff too. So veterinarians anywhere at any time in any given part of the world are usually pretty busy. And so amplifying that to somewhere like in the Upper East region where one DVM holder may be responsible for several communities, there's just not that much free time. So it was really about being adaptable. People's schedules may change very quickly. Emergencies may come up, and just learning to work around that. And so also transportation as well. So many of the roads in the region we're in are like dirt or gravel based roads. And so it was the rainy season. So if it did rain, it could wash out a road. It could make travel very hard. And a lot of people in that region that we were engaging with may have not had access to transportation. So we were oftentimes going to them. Cars may break down, tires may blow out. There's not like a Mr. Lube down the road. So just trying to manage all those things. We've definitely had a couple roadside wait outs. But yeah, next one, please. And then my personal favorite and my biggest takeaway from my time there is the amount of networking and collaboration I was able to do. And then I'm definitely going to bring forward into my professional career. So we needed the survey to be well designed from a research standpoint to make sure that we're collecting appropriate data, but we also need that data to be understandable, digestible, and culturally relevant. So when coming up with the survey questions, we were able to collaborate with not only some of my OVC colleagues, but also researchers and colleagues of Dr. Kunzle, who is the head of GAPNET, in evaluating our questionnaire, coming up with new questions, kind of getting all that feedback. So that was really nice. And then also while conducting the research, we were able to kind of have a lot of one-on-one time with the veterinarians in the region. And it was really nice to be able to discuss like what is the state of the profession in Ghana? What are some of their challenges? How are they going about those? And being able to discuss the same things that are happening in Canada and kind of those overlaps and things that are different. And so ultimately, I think it was such an important opportunity to engage with locals and building a network that can lead to future collaborations and kind of always expanding the network of people you know, and having people from different backgrounds with different viewpoints and coming at things from different angles is always just an amazing tool to have in your toolkit. Yeah, and this is a picture we took like on our first couple days when we were in UM. We walked over to the U.S. Chief's Palace and we were welcomed into the community, told them about the work we were doing. There's also some sub-chiefs here, as well as some local leaders pictured in the photo. Yeah. Next one, please. Thank you. Oh, you're already ahead of me. And then last one is adaptability. So kind of covers all of the things I talked about before. You know, people are really busy, so adapting to their busy schedules. And then also about communication styles, like we talked about before. And then one thing I think that was really big is that, at least what I found in Ghana, that the way time is interpreted or the way Ghana culture views time is very different than what we do. So I recently learned that it's called monochronic cultures versus like polychronic cultures. And so it's not that one place doesn't care about time and one place does. It's just more that the way time is viewed and the way people engage in time and have activities going is just different. And so I've taken a lot of that back home with me and how I engage in time and how I engage with people in my life that also maybe come from a polychronic background. And so, yeah, just being very adaptable. But all in all, I think I truly learned that working with colleagues from other countries and other cultures can obviously come with its challenges like anything does, but with an adaptive, open-minded attitude, it's the opportunity of a lifetime. And it has endless learning and development opportunities for myself, alongside being able to just help amazing on the ground grassroots organizations kind of execute these awesome initiatives they have going. So yeah, thank you. And I guess I can talk about this one, but this is just a slide that Sandra put at the end that kind of highlights all the stuff we did outside of work. So yes, we did work, and the work didn't feel like work. It was super fun. But outside of that, we also got to do touristy things. And so on the top left, we have Cocoon National Park, which is, I think, two hours outside of the major city in Accra. So we got to do a nice canopy walk. We see the Hippo Sanctuary here, which is in the Upper West region. So we did like a 6-hour car ride with each other, went here, got in a really small canoe and went in some water with some live hippos, but it was absolutely fantastic. This is Pega Crocodile Pond. You can see us here like touching the crocodiles. So these are totem animals for this community. They're very well respected and they're very preserved, and they're almost kind of semi-domesticated at this point. They're really well revered by the community members, so people can actually swim in these ponds with the crocodiles and etc. Top right, we have Moose and Bonku, my godchildren, our godchildren. And Bonku is now Marley's son, and Moose was neutered in the Upper East region, and we gifted him to our, I feel like our host or our guidance, like our total mentor while we were there, who was the UA sub chief, Izaka. So we gifted Moose to him, and he's living a great life in UA right now. And then Marley and Sandra got to go to the Atomi Monkey Sanctuary, you can see in the bottom right. Mole National Park on the bottom left, where we literally had elephants like walking in front of our room when we exited. And then Wana Palace. And I think that's everything. And then we have a final slide. All of us are super open to, if anyone has specific questions about our experiences, our backgrounds, or about VWB, we've put our emails here, and it is open for anyone to email any one of us at any time. So thank you for listening. And if you have any questions, I think there's a raise your hand feature or a Q&A box, but I think Megan is going to be taking over now. Okay.
Thanks, Keisha. Yes, we have a few questions already coming into the Q&A. Before we get to the Q&A, Marley, can I get you to stop sharing your screen so I can share a couple slides? Awesome, thank you. All right, really quickly, some logistics about the Young Volunteer Program. So for 2024, we are recruiting now, and our in-country placements will be 12-week placements from May to August of 2024. And you'll be supporting our VETS program activities and partners in Ghana, Kenya, and Laos. So we're looking for current university students or recent graduates with specialties identified by our partner organizations. And we're looking to send teams of 2 to 4 young volunteers for each partner. So with animal health specialists, as well as gender and communication specialists. So maybe you yourself are interested in applying, or you know someone who would be a great fit for this program. Our eligibility requirements: you must be a Canadian citizen or permanent resident, 19 years of age or older, fully vaccinated against COVID-19, a current student or a recent university graduate within the last 5 years, and expertise in any of the following. So a lot of animal health expertise, as well as gender and communications. And our last eligibility requirement is that you're able to commit to the entire duration of the program. It's a fully funded placement. So your travel and accommodation for your mandatory pre-departure training course in Ottawa is covered. Return airfare to your placement country and any costs for visas, permits, vaccinations, anti-malarial medication, and overseas emergency travel health insurance. And then there is also a monthly living allowance, which will cover your housing and food in country. If you're interested in joining a YVP team, you can check out our website for all the application instructions and the full list of placement descriptions. Our application deadline is October 23rd. And if you have any questions, you can email me directly at volunteer@vetswithoutborders.ca. I'll be happy to answer any questions that you have. I also realized that I forgot to introduce myself at the start of this presentation. My name is Megan. I do work for Veterinarians Without Borders, and I'm the program officer for volunteer mobilization. So any questions that you have about volunteering or about the Young Volunteer Program, please send my way. And we have a few questions in the chat. So we have about 10 minutes left, so I'll try and answer some of these questions, or as many as we can, and I'll try and answer them pretty quickly. I'll let Marley and Keisha and Sandra chime in for some of these questions. So the first question is about the vaccination campaign. Who provided the vaccines, medications, and supplies in the field? Were they brought over from Canada, or were they purchased in Ghana? So the vaccination campaign that Marley talked about in the presentation, the Young Volunteers were participating in this campaign, but this vaccination campaign was led by the Economic Community of Western African States, or ECOWAS, I believe is their acronym. So they were the ones leading this vaccine campaign, and they provided all the vaccinations. Question for the three of you. What kind of materials did you use for these trainings? So were you using posters, slideshows, etc.?
I can answer that one. So it was very basic. We really just, everything was verbal, and then we had like little poster boards that we made for some of our topics, or sometimes we would have little images printed out, or like on our phones even, that we would just pass around through the group. So it was very rudimentary. Yeah, mostly just, yeah, us talking and a couple visual aids. It was just very basic stuff.
Thanks, Sandra. So a question about the community animal health workers team, and I know, Keisha, you talked a little bit about the community animal health workers, but the question is, how do community members become community animal health workers? Could you talk a little bit about the background of the community animal health workers?
Yes, I can, very overview, but yeah, so for community animal health workers, from what we were told when we were in Ghana, is that they have all these requirements they need to meet, but they've only had one. Well, now they just did their second, but they had one wave of, I guess, like hiring or volunteering, where GAPNET with local community leaders would select people to be trained. So it's 2 per community. There's 13 communities right now, and they would just go through training. I think there's a few requirements in terms of like their ability to stay in the region, that they can't like leave. They're not supposed to be treating animals or providing treatment outside of their borders, as to not have competition or anything like that. But yeah, typically they're stewards of their community that will not be leaving anytime soon, that are wanting to be community leaders, and they go through pretty rigorous training with GAPNET. So I don't think they really have to have a background at all other than being literate in English. So they can be able to read and write in English. Oh, but GAPNET just did their training for, I think, like 20 or 30 new cows, I think finished up a couple weeks ago. So that's really exciting.
Awesome. Thanks, Keisha. Had any of you volunteered internationally before, and what inspired you to do so?
I can answer this one. So I had never done any sort of international volunteering. I'd done quite a bit of volunteering in Canada with some nonprofit organizations. So I felt like I had a fairly good grasp of understanding the responsibilities of what it means to be a volunteer, and kind of the nuances with the nonprofit sector. In terms of inspired to volunteer internationally, I think I was just looking for a unique experience. It's coming out of COVID. I was hoping to do some traveling, but I wanted to continue to gain veterinary experience and continue to grow my other skills. And so I did a bit of Googling and came across Vets Without Borders. And yeah, reading about the VETS program and the opportunities that it provided, I thought it was a perfect fit. So I took a chance and applied, and was lucky enough to get accepted. So yeah, for me personally, that was my inspiration.
Thanks, Marley. This is a question about your survey, Keisha, that you talked about, or the survey you all did. Someone's asking, can we have access to results of that survey? What are you doing with the results of that survey?
Yeah, so with the survey right now, the raw data is with GAPNET. And so I think the next steps are to have someone who's formally trained in stats analyze the data and pull out any significant results. And then hopefully, if the data is good and we get results from it, ideally be published. But I think that would really be up to GAPNET and VWB if they wanted to publish those findings and make them available. But I'm in my master's of public health right now. So I'm doing a poster board presentation on the questionnaire component of that research and the development of it, and some of just the common themes that we found in our research. So I'm going to send that to BWB, so that might be available at some point, maybe.
Yeah. Perfect. Thank you. I see someone has their hand up, so I'll allow you to ask your question. Joseph, if you want to ask your question. You just have to unmute yourself.
Okay, you hear me now?
Yes, perfect.
Okay. Yeah, just a comment. I'll take this opportunity to thank the volunteers who came to Ghana. They did an excellent job, and I'm very appreciative for the service they provided to the community. The other thing I would like to comment is in future, though they did a vaccination on PPR, when we did it in Salaga, Savannah region, 2 or 3 years ago, I would say probably 2019, before the COVID. In 2 weeks' time, partnering with the district veterinarians, we handled over 6,000 ruminants, and including the vaccination, we also dewormed these animals as well. So I think it's something that Megan, in future, if they do the vaccinations, they should also include the deworming. So these animals were vaccinated for PPR, and at the same time, they were dewormed at the same time, which means it gives a better protection. Most of them die not because of viral disease, but also because of worming, both internal parasites. So that's just a comment. The other thing that I would like to make a comment on is the timing. Of course, time is not of essence to any Ghanaian community, whether you're in the north, in the southeast, or west, it doesn't matter. But I'm very glad that they talked about adaptation. Any country you visit, you have to adapt to the food, to the weather, to the social aspect of it, social activity, culture, everything. And I think in all, they fitted very well, communicated very well with the locals. Language is an issue because English is the official language, but most of them are illiterate. So even the interpreters, sometimes the interpreters could go wrong. You don't know what they are saying. And I've had experience during the training where the interpreter was not really saying what I was saying. So that could be a challenge. And I think they all realize that as well. But I'm very happy that they went, and I hope that the next group will also have the same fun and still be busy. You are not going to have a busy time all the time, but at least the little time you have, you can also have fun. And I'm very glad that they enjoyed it and they are back and to continue their normal activity in Canada. So bravo, thank you all very much.
Thanks, Joseph, much appreciated. And we have another person with their hand up. Dr. Therese, I'll let you ask your question.
Okay, good evening from Nigeria. My name is Dr. Shadrach. I'm a veterinary doctor here in Nigeria. I must commend the amazing work you all did in Ghana. 2 weeks ago or so was when I actually stumbled on Veterinarians Without Borders. So I checked you out, signed up on your newsletter. So I got the notification that this was happening, so I made it a point to join. So I have an animal health company called Vet Connect. And what I'm doing with that is to leverage technology to be able to improve access to animal care for livestock farmers and pet owners. Because I mean, globally, of course, but again, in Africa, one of the biggest challenges we contend with here is the lack of access to animal care, especially qualified care. So in Nigeria, what I've done with that is to connect currently over 1,500 veterinary doctors who are now visibly accessible. So we're actually trying to take a next step to open up the platform to other African countries after we have done a lot of research to make it, more or less an African solution and not just a Nigerian solution. So my question would be, as far as this goes, does it align with the interest of Veterinarians Without Borders? And how can we be able to find a middle ground to be able to amplify the work you do?
Sorry, your question is if the work you're doing is...
Hello?
Oh, sorry, you cut out a little bit. Your question is if the work you're doing is aligned with the work of Veterinarians Without Borders?
Where the work the organization does aligns with our core vision of advancing visibility for veterinary doctors. And of course, a second layer would be para-veterinary doctors for livestock farmers and pet owners, so that in the future we can be able to see how we can plan projects together and see that work. And then secondly, are you having interest in seeing how your work can also extend to countries like Nigeria? Of course, Ghana is our close neighbor, but we'll be happy to welcome you to Nigeria too. So those are my two questions. Thank you.
Okay, great. Yeah, we're running a little bit out of time, but in terms of where we're located and where we're looking to work right now, the project that we're currently working on and we were talking about today is a 7-year project that will go until 2027. And it's working in 6 different countries in Africa and Asia. So those countries are all determined right now, but in future, after that, yeah, we might be looking to work other places. I just don't think that's been determined just yet. All right, I have time for one more quick question. Someone was just wondering what their chances of getting accepted as a young volunteer are after completing 2 years of undergrad. It really depends on your personal experience, your resume, what you've been working on in your undergrad and outside of school. So it would really depend. I would recommend sending an email if you have questions about that, just so I can look into your own personal resume and background. And also, just if you're not entirely sure, I'd still recommend that you apply, even if you aren't accepted as a YVP this year. You might be accepted in a future year. So definitely still worth applying or connecting with us to talk about that. And I think that's all we have time for. We've gone a little bit over time, but I just want to thank everyone for coming to our webinar, and thank you to our wonderful presenters, Marley, Sandra, and Keisha. It was great to hear about your experience in Ghana.
Thank you, Megan. Thanks for coming, everyone.
Thank you, everyone. And yeah, anyone who is here thinking about applying, I encourage you to do so. It's a great experience.